So if we teach the inhalation technique, how do we use the inhaler? It has a particular technique. As I told you, before each inhalation, you should be sitting completely relaxed and in an upright position. Take a deep breath and exhale out completely, which means that taking out everything of your lungs to the maximal possible effect. Once you exhale out, you have to shake your inhaler well, remove the cap, keep it between two of your lips, and press your lips completely so that no gaps remain between your mouthpiece of the inhaler and your lips. After that, you have to press the inhaler and inhale like this, which means that I inhaled slowly and deeply in case of a spray inhaler and remained there for 10 seconds, counting inside of my mind, 10 seconds, and then exhaling through my nose. On the other hand, if we consider dry powder inhalers, this action has to be faster and deeper. The reason is, for the powder to come out of that inhaler device, you actually need quicker power to release those particles and disintegrate them from the rest of the particles. So the action should be quicker and deeper in case of dry powder inhalers, and it should be slower and deeper in case of pressurized MDIs or the breath actuated inhalers. On the other hand, if we see nebulizers, there is no particular action which is required for the inhalation. You can sit down completely, inhale deeply, and exhale according to your own comfort levels. However, in between, you should try to hold your breath for a period of 10 seconds for maximum amount of sedimentation which can happen inside of your breathing tubes. So, in nebulizers, do not forget to demonstrate the use and check for the understanding of your patient. Last but most important, counseling. Why we are giving these inhalers, how they should be used, what is the recommendation for their cleaning. Each of these should be explained very, very well for your patients.